Today we are at Radisson Blu, having our East Africa dialogues and looking at allyship and how it contributes to gender equity and supporting women in their leadership trajectory.
We had our very first East Africa dialogue, and it was an opportunity where we brought together women leaders, male allies in the health sector to start talking about what does it take to advance women leaders in health, and in particular, what is the role of allies in helping support that.
We are engaging all our stakeholders on a discussion around allyship. We were looking at male allyship, senior women allyship, and peer allyship. All this is around how we can support women in their leadership trajectory. We need women in key decision-making areas, because when women are in decision-making, then we can impact our health outcomes and achieve gender equity. And we cannot do this alone. We need male allies with us. And allyship is really just looking at how you use your privilege and power and influence to support the one that doesn't have it.
Women are the bedrock of the health sector. In fact, they're 70% of the health workforce. And yet when you look at who is in the leadership positions, what we find is women are less than 30% of the leadership positions. So as WHO, the World Health Organization, says, health is delivered by women, but it's still led by men.
Based on our discovery analysis, we found the top 3 challenges that women are facing is inability to navigate politics, inability to balance work and life, and as well, gender discrimination and sexual harassment in the workplace. All these things come together to inhibit or to create barriers in terms of women moving up in their leadership trajectories. Men can come in to support women by ensuring that their voices are amplified, that they create space for women leadership in the decision-making tables, embracing and appreciating the value of women's leadership, because they bring in lived experience. And this experience is what can shape our policies, can shape how we budget for health, can shape how we design programs that are meeting the communities which the women are in. So we really want to move from, women just as caregivers or, recipients of help, but also just being leaders and being in the decision-making spaces. So if we have men supporting this, using their power and privilege and the patriarchal advantage that they've had to make space for women, then we can truly impact health outcomes. And so we need the men. We need everyone on board. Everyone is an ally.
You have an important role to play. You have an important role to play in taking action yourself. It's only when all of us are contributing in our own ways to furthering women's leadership, to advancing women leaders, that we can get there. And so I would say, identify to play. You have an important role to play in taking action yourself. It's only when all of us are contributing in our own ways to furthering women's leadership, to advancing women leaders, that we can get there.
Let us support women, let us be allies, let us work together.